Okay, everybody, we are going to do our skeletal system next. So I said it in our last recorded lecture, but I just want to make sure I mention it again. We have two different vocab lists. So for week 4, under the vocab list, you'll see this one, skeletal and muscular system terminology. So this week, we're going to be doing skeletal and muscular system. And then last week, we had our integumentary system terminology. So we need to study both lists because your week 2 or unit 2 test is coming up by the end of this week. So really get on top of those words sooner versus later. Okay. All right, like we have done before, we are going to go over a case study as a way to walk through some of these new words. So I'm going to go ahead and read this so we can get our pronunciation down. A 30-year-old male patient made a visit to our clinic with a chief complaint of painless edema in the lower left back tooth region for 3 years. Patient also gave history of dysphagia. Patient gave no history of any deleterious habits. No signs of extraoral abnormalities were detected. Intraoral examination revealed a round immobile nodular swelling on lower left posterior region, extending from second premolar to second molar. Panoramic radiograph revealed well-defined radiographic mass extending from lower left second premolar to lower left second molar. Considering the clinical and radiographic findings, peripheral osteoma of mandible was considered. The bony mass was surgically excised with sufficient safety margins and later sent for histopathological investigation. The histopathological specimen revealed dense, compact bone with little fibrous connective tissue stroma at the periphery. Osteoid cells were present, hence a final diagnosis of peripheral osteoma of the mandible was considered. Let's take a quick look. So you see this football-shaped mass here. This is what they're talking about. This is that osteoma of the mandible. Okay, so we underlined some words here that are medical terms. So go ahead, pause the video, and take some time to try to not diagnose, but define these med terms. So take your time and then come back and restart the video after you gave it your best go. Use your new word list to help you out. Okay, so we're going to go through this case again, but this time we will replace our underlined words with their definition as we're going through it. A 30-year-old male patient made a visit to our clinic with a chief complaint of painless edema, which is another word for swelling, in the lower left back tooth region for 3 years. Patient also gave history of dysphagia. You guys should have been able to get what this one. So dys is painful or difficult, and phagia is our suffix for swallowing. Patient also gave history of difficulty or painful swallowing. Patient gave no history of any deleterious habits. No signs of extraoral abnormalities, so no abnormalities outside of the mouth were detected. Intraoral examination, so within the mouth examination, revealed a round immobile nodular swelling. So nodular is going to be kind of like a circular or spherical lump on the lower left posterior. You should know that's in the back region, extending from second premolar to second molar. So this is the back left side of our patient's mouth. Panoramic radiograph, we've seen that word plenty of times. That's an X-ray. Revealed well-defined radiographic mass extending from lower left second premolar to lower left second molar. So that's talking about that football-shaped mass that we saw on that X-ray when I pulled up the figure 1. Considering the clinical and radiographic findings, peripheral osteoma, so oma is going to be a tumor, and is our word root for bone. So a tumor of the bone, and our mandible is your jaw. So a tumor of the jaw. So bone of the jaw has a tumor. The bony mass was surgically excised. Remember, an excision or to excise something is going to be surgically remove it with sufficient safety margins and later sent for histopathological investigation. So we can break histopathological into three parts. Logical is going to be study or investigation in a sense, study or examine. Hist is tissue, path is disease. So it's the examination or study of a tissue to determine if it has any disease. So histopathological, they're trying to identify exactly what that tissue that they removed is. The histopathological specimen revealed dense, compact bone with little fibrous, so FIBR is our root for fiber, and OUS is just, again, pertaining to or state. So fibrous, it just is fiber. It has a lot of fibers in it. Fibrous connective tissue stroma at the periphery. And then osteoid cells. Sorry, I'm trying to get this. There we go. Osteoid cells were present. So oste, again, that's our root for bone. And oid means resembling. So the tumor looked like bone cells, but it wasn't true bone cells. This was a cancerous bone cell. So it was resembling bone. Osteoid means to resemble bone. Hence, a final diagnosis of peripheral osteoma of mandible was considered. So they think it's a tumor of the mandible or a tumor of the jaw, more specifically a bony tumor of the jaw. Okay, so you certainly do not have to memorize every single bone in the body for this class, but we are going to talk about them just a little bit. So you have the axial skeleton. So this is going to be everything that's right in the center. So it starts with your skull and your facial bones. So you have multiple bones that make up the skull and the face to protect your brain. You're going to go right down the neck. So our individual segments of our spine, from the neck all the way down through the lumbar spine, are known as vertebrae. So each individual segment is a vertebrae, and each of our vertebrae are separated by a disc or a fibrocartilage disc. So our neck portion of the spine is called the cervical spine. So anytime you see the word cervical, it's going to mean the neck or our cervical spine. We have 7 vertebrae in our cervical spine. Let me see if I can get him paused on the right spot. There we go. Okay, so we have 7 vertebrae in our cervical spine. And then we have our thoracic vertebrae. So we have 12 thoracic vertebrae. That's our mid-back. And you can see our ribs connect to our thoracic vertebrae. So that makes our thoracic spine much stiffer than our neck and our low back, or our cervical and our lumbar spine. So 7 cervical vertebrae, 12 thoracic vertebrae, and then you get down to the lumbar spine or our low back. That's going to be 5 vertebrae. And then all the way down low, we have our sacrum and coccyx, which is kind of covered by this pause button. But you'll see as we rotate around, you have your sacrum, which is this flatter bone here. And then your coccyx is the tailbone. So your sacrum is below your lumbar spine, and then your coccyx or your tailbone is inferior or following the sacrum. Our ribs are also included in our axial skeleton, and you'll see they come up and connect to our sternum, another part of the axial skeleton. So we have 12 total ribs. So we have the same number of ribs as we do thoracic vertebrae, and 7 of those ribs attached to the sternum. Those are called our true ribs. And then 5 of those are called our floating ribs or false ribs. So you can see back here we have some ribs that don't wrap all the way to the front, and even down here we have a few that wrap into the 7th rib before they go back to the thoracic. So you guys don't need to necessarily memorize everything I just said. You should be able to identify that these are the bones that make up the axial skeleton. And you'll see next slide when we do the appendicular skeleton, that's everything else. So if you know the bones that make up the axial skeleton, then you know what makes up the appendicular skeleton because it's just everything besides these few. All right, we're going to do a lot more practice in this lecture because you guys have a lot of words to learn in a short period of time. So this will give you good practice with your new list. So again, go ahead and pause the video and define the following words or write the term if the definition is written. Okay, let's go through each word here. So pertaining to the head. So we could say cranial, like it is just right below, or the other way we could say it is cephalic. Cephalic. So either of those would be correct. So cranial could be is pertaining to the head, and more specific, cranial is referring to the cranium, which is the bones that make up our skull. Okay, cervical we said is our neck, our cervical spine. So it's referring to the cervical spine or it's referring to the neck, pertaining to the neck or cervical spine. Pertaining to below the ribs, I think there could be multiple right answers for this one. So you could say subcostal. So cost is our combining or word root for ribs. And there's a few different suffixes or prefixes for below. So subcostal. I think you could say infracostal. You could say inferocostal. That would be less common to hear. You would probably hear infracostal or subcostal most often. And I think, like on a test, if I asked you this, I would take hypocostal as well, but that would be another one that you probably would not hear used in real life application. You'd probably hear infracostal or subcostal. Okay, our next one, discectomy. So remember when I was talking about the spine, I said each individual vertebrae is separated by a disc. So our word root for disc is simply disc. That one's an easy one. So discectomy, this was from our list last week. So ectomy is going to mean surgical removal. So surgical removal of a disc. So if you've ever had any family or friends that have had a herniated disc, sometimes this is a procedure that they'll do to clean up some of that herniated material, is a discectomy. Okay, submandibular. So we said in our case study, our mandible was our jaw. So that's our combining form. So I said you don't have to memorize all the bones in the body by any means, but there are some bones and body parts that show up on your word list as word roots or combining forms. So those you need to know because those are part of your vocab. But bones or stuff that's not on your list, you do not need to know. So submandibular, let's go back. Our jaw, so it's pertaining to or relating to the jaw, mandibular, and we said sub means below, so submandibular would be below the jaw. Okay, suture of the maxilla. I'm not 100% sure if maxilla is on your list off the top of my head, but your maxilla is another one of your facial bones. It forms your upper lip kind of just below the nose. That's where your maxilla is. So suture is a new word for you. That's one of your new suffixes. So the suffix for suture is rhaphy, R-R-H-A-P-H-Y, rhaphy. It's a weird one. So the combining form for maxilla is basically just drop the A off and add your \O. So a suture of the maxilla would be a maxillorrhaphy. Maxillorrhaphy. Lumbar, we said, is our low back. Sorry, guys, I can't control it popping up on me. Okay, pertaining to above the sternum. So pertaining to above the sternum. So I think this is another one that you could probably have at least two right answers for. Suprasternal is would be probably the most common. Suprasternal. Oops, sorry guys. Suprasternal. I think another one you could use is superosternal. Episternal would not be a good answer. So epi means really more like, yes, it's there's above in the definition, but it really means more like on top of or sitting upon. So I would not use the term episternal. And same, I would not use the term hypersternal. Hyper means more excessive, even though we said hypo can be below. Hyper is used more as an excess versus truly above. So suprasternal or superosternal, I would say, are two good answers for that. Myelitis. So itis we've seen a lot of times. Remember, that is our suffix for inflammation. So this is inflammation of what? We have myel is a new word root for us, and that is going to be our spinal cord. So myelitis. Our next one is orthogenesis. Orthogenesis. So ortho is another combining form in word root for bone. Genesis is our suffix for growth, but not just any growth, it's new growth. So genesis, it's being generated. So new growth of bone. So orthogenesis. So if it said orthoplasia, you could just say bone growth, but orthogenesis is going to be new bone growth. Okay, kyphosis. You guys don't necessarily, let's see, let's double check. Yeah, okay, I thought so. I just didn't want to tell you the wrong thing. So kyphosis, this is the term for a rounded spine. So this isn't on your word list, but this is good to know as it relates to our spine. So let's find a good spot to stop this. Okay, perfect. Okay, so kyphosis is this rounded. So if you were to sit with bad posture and kind of let your shoulders hunch and drop over, you would accentuate or exaggerate your kyphosis. So that's a kyphotic posture. So kyphosis means this rounded curve, and then this curve in our lumbar spine, it goes kind of the opposite way of our thoracic spine. That's called lordosis. So we have lordosis in the lumbar spine. We have kyphosis in the mid back, and then we have lordosis in our cervical spine or our necks. So kyphosis is this rounded posture. Lordosis is kind of this arched look. All right, idiopathic scoliosis. So you should remember idiopathic from unit 1. That means of unknown cause. And then scoliosis is a curvature of the spine that is not natural. So if the spine curved out this way or curved out this way to the right or the left, that's scoliosis. It's when it moves to the side. A spondylosis. So spondyle is one of your word roots for vertebrae. So a spondylosis, this is an abnormal condition of a vertebrae. And so in this case, what's happening is there's some breakdown of the bone from the pressure of one vertebrae on another. And if it progresses further, it's called a spondylolisthesis, meaning that your vertebrae actually slid forward on the one below it. So spondylosis can lead to instability. But you guys should just know spondylosis is an abnormal condition of the vertebrae. And then our last word, vertebrectomy. So vertebra, this first part of the word, is our other word root for vertebrae. And then again, ectomy is surgical removal. Okay, so like I said, the appendicular skeleton is everything else. So there's no reason to memorize your appendicular skeleton. Like I said, there's some combining forms that you'll need to know based on the bones that you see on your list, but you don't have to memorize every single bone. So let's just do some practice again. So we're going to go through and give yourself some time to try to do the same thing. If it's the word there, write the definition. If it's the definition, go ahead and see if you can come up with the word, and then we'll go over it. Okay, let's go ahead and go over our words. So intrascapular. So scapular is going to mean referring to the scapula, which is your shoulder blade. So you have one scapula and you have two scapulae. So that's one of our weird plural ones. We have to add an E to the end of scapula to make it plural. So one scapula, two scapulae. Intra is our prefix for within. So intrascapular, within the shoulder blade or within the scapula. Brachioplasty. This was from our first list. Plasty is going to be surgical repair. Brachio is our combining form for arm, or so brachioplasty is going to be a surgical repair of the arm. Intercarpal fusion. So our carpals are our wrist bones. Inter is within or in between, really. So intra is within, inter is in between, and a fusion is when they basically screw bones together. So an intercarpal fusion would be basically connecting your wrist bones together. Inflammation of the clavicle is clavitis. So the clavicle, our combining term is just C-L-A-V, clavitis. Or sorry, I apologize. I'm wrong. It's claviculitis. So clavicle, our combining form is claviculo, C-L-A-V-I-C-U-L, claviculo. So claviculitis. Sorry, I tried to shorten it up too much. Okay, humerectomy. So brachioplasty. So I'll show you. Brachy. So that's going to be arm, brachio. And then we also have humero, which is going to be humeral. So brachio means arm. Brachio means arm. Humera is referring to our humerus, which is our upper arm bone. So that's part of our shoulder all the way down to our elbow is our humerus. So a humerectomy would be a surgical removal of the humerus. An abnormal condition of the ulna. So I think you could have kind of two right answers for this. So osis is our suffix for abnormal condition, or pathy is also a suffix that means abnormal condition or disease, really. So you could say ulnosis or ulnopathy. So our combining form for ulna is basically replacing that A with our \O. Okay, iliosacral. So ilio is our combining form for our ilium, which is part of our hip. And then sacral is going to refer to our sacrum. So iliosacral is referring to where our ilium and sacrum attach. So our iliosacral joint is usually what that's going to refer to. Hemipelvectomy. So hemi is going to be half. Pelv is going to be for the pelvis. And again, ectomy is surgical removal. So surgical removal of half of the pelvis. So remember, when we actually write out our definition, we're working from suffix back to the front. When you're thinking through it, I don't mind how you do it. But when you're actually writing your definition, always start suffix and move back forward. Okay, breaking of finger bones. So a suffix for breaking could be clast, which usually means fracture. And you could also say clasia, clasia, if it was happening during surgery. So clast or clasia would be a suffix that would be correct. And then our combining form for finger is going to be dactylo. So dactyloclast or dactyloclasia would be a correct answer for this one. Acetabular. So our acetabulum is the socket that our hip sits in. So our femur is our big upper leg bone, femoral, our big upper leg bone, and the neck of our femur and the head of our femur point and fit into the acetabulum. So acetabular is going to be referring to the hip joint. Femoral is going to be referring to your upper leg bone. So this is the acetabulum, right where our femur is meeting the pelvis. This is our femur, this big leg bone, biggest bone in the body. All right, a fibuloplasty. We already said earlier on this slide that plasty means surgical repair. Our fibula is going to be this little skinny bone on the outer part of our lower leg. So a fibuloplasty would be surgical repair of the fibula. Then our bigger lower leg bone or shin bone is the tibia. That's our tibia. All right, within the patella, so intrapatellar, intrapatellar. Paralysis of the tibia. Oh, I'm sorry, I should say our patella is our kneecap. That's your kneecap. Patella is the bone that is your kneecap. Okay, now we'll do paralysis of the tibia. We had a suffix for paralysis in our last lecture. That was plegia. So tibioplegia would be paralysis of the tibia. So you'll see a theme with a lot of our bones here that the combining form is more or less just dropping a couple letters off and adding our suffixes. So tibioplegia is paralysis of the tibia. All right, torsional. Torsional means to twist or a twisting force. So bones are very weak against torsional forces. They do not handle twist or rotation well. They're great against stretch. They're great against compression, but twisting is usually what results in a fracture. Okay, last one, tumor of the calcaneus. So our calcaneus is our heel bone. So our heel bone is our calcaneus. So just like some of our other bones, our combining form is going to be calcaneo. So remember, tumor is going to be oma, O-M-A is our suffix. So a calcaneoma is a tumor of the calcaneus. All right, we're not going to talk a lot about joints, but you should know that these are our three classifications. So as you look on your screen left to right, we're going to go from pretty much no movement in the joint to a lot of movement in the joint. So the first category is thin arthroses. So remember our term or our prefix thin means together. So arthro is going to be joint, so a joint that's together. So it's no movement. They're very much connected. So one or the best example of this is a suture of the skull. So a synarthroses is a joint that has almost no movement. Amphiarthroses, these are going to have some movement. they'll be able to have a little wiggle, but they don't move a lot. So our pubic symphysis, so we have a piece of cartilage right in between this gap in our pelvis. That's your pubic symphysis. It has a little bit of wiggle room to it forward and back, but not much. Your intervertebral discs, the discs in between each individual vertebrae in your spine, are another example of an amphiarthrosis. And then what we think about as our joints, a majority of our joints are these diarthroses. So they're free movement. Our shoulder can move all over the place. Our knee only moves back and forth, but it still has a fair amount of movement. Our elbows, our wrists, our ankles, pretty much everything else, a majority of things are these diarthritic joints, diarthroses. Like I said, you should know these three categories. If I just gave you the definitions, you should be able to match up the names. Okay, we're going to talk about a couple other structures that are related to our skeletal system, even though they're not actually bones. So the first one we'll start with is our cartilage. And I just noticed that there's a little bit of a typo here. So there could be an 8 after the C, just like there is down here. So sorry about that, guys. Our combining form for cartilage is chondro. And so our first one, itis, inflammation of the cartilage. Oma is tumor, cartilage, tumor, or tumor of cartilage. Plasia is growth. A is without. That means this is without cartilage growth. So that's cartilage. So we find this in pretty much all of our joints. So we'll find cartilage. So there's a few different types of cartilage. So those different joint types that we talked about on our last slide have different types of cartilage, and that's why they have different properties. Okay, the synovial membrane, this is what kind of surrounds our diarthroses, our diarthritic joints, our knees and our shoulders. They have a synovial membrane around them that secretes synovial fluid, which is kind of like an oil or lubricant for our joints so that it prevents friction and they can move around much more easily. So centesis is from our first word list. That is a surgical puncture. And then arthro is going to be the joint itself. So arthrocentesis is usually fluid removal from a joint. So if a joint's real swollen and they want it to come down quicker, they'll stick a needle in and pull out the fluid. Okay, let's go ahead and do meniscus next. So this shows your knee. So the menisci, you have a medial and a lateral, are these little discs in between your femur and your tibia. So they help your knee kind of hold together better. So meniscus. So your combining form is menisco. And then remember this one from earlier, this is our weird one, raphe, that's our suture. So a meniscography is a meniscus repair, or putting a suture into the meniscus. You'll also sometimes hear of a meniscectomy, where they just cut out a portion of the meniscus that has a tear. All right, ligaments we can show here too. You have your ACL, which is a common one to be torn in athletes, that runs across here. So ligaments connect bone to bone. Ligaments are always going to be bone to bone. So our knee actually has 4 ligaments. We have an anterior cruciate ligament, a posterior cruciate ligament, a lateral, and a medial ligament. So we have an ACL, PCL, MCL, and ACL. So ligamental torsion would mean twisting of a ligament. And then an ACL repair obviously would be repairing your anterior cruciate ligament or that ligament. So ligament is always going to be bone to bone. That's what you need to know. So tendon, you'll see on your list, has a few different word roots that you can use for it. It has tendon. It has teno on there as well. So there's a couple of different ones. So tendons are going to be muscle to bone. So ligaments are our bone to bone. Tendons are muscle to bone. So you see our quadriceps muscle comes in and attaches via the quadriceps and patellar tendon into our kneecap and tibia. So tendinitis, there's our inflammation of the tendon. Tenodesis, that's a surgical fixation. So surgical fixation of a tendon. A tenotomy, that's a cut into a tendon. So maybe they're having to cut a little piece out. That's having a tear or is inflamed. And then our patellar tendon is what connects our kneecap to our shin bone and helps our quadriceps move our lower leg. So when your quad squeezes and kicks out, it pulls your leg up, and that force is being distributed through your patellar tendon. Last one is the bursa. So you may have heard of someone that has bursitis or inflammation of the bursa. So you can think of a bursa like a Tide Pod. It's a little tiny sac that has a gel in it or fluid in it, and it provides some cushioning in areas where there may be some rubbing of bone, or a ligament or a tendon is going to be directly on top of a bone. Like this diagram doesn't show it, but there's a little bursa that's right behind your patellar tendon, so it doesn't rub up against your knee joint. So bursa is just there for cushioning, but it can get irritated. So that's inflammation of the bursa. If it keeps getting irritated and causing problems, sometimes they will perform a bursectomy, or a surgical removal of the bursa, or a bursotomy, where they just cut a portion of the bursa, or they may do a bursocentesis, just like the arthrocentesis, where they can puncture and pull out fluid. So these are just some other things related to our skeletal system besides the bones that will show up on your list here and there. Okay, some of these may be in the additional terms on your list. So remember, make sure you look at those additional terms. The prefixes and the suffixes and the word roots are obviously very important in a large majority of our tests, but you'll also see that some of the matching and multiple choice questions come from those additional terms section 2. So do not ignore those when you are studying. So go ahead and see if you can use your word list to figure out what these diseases mean. Some of them you can figure out just by the definition using your word parts, and some of them are a little less straightforward, but we'll go over them together in a second. So pause and put down your answers and restart when you're ready. Okay. Let me go ahead and reveal them. So osteoporosis. So porosis means weakening or thinning. So osteoporosis, remember, osteo is going to be bone. So that's bone density loss. So bone thinning or bone weakening is osteoporosis. Arthritis, that's a straightforward one. Itis is inflammation. Arth is joint. So joint inflammation is arthritis. The classic type of arthritis that you hear about people getting knee replacements and hip replacements and stuff like that for is osteoarthritis. Okay, osteomyelitis is a bone infection. So osteo is for bone, of course. Itis is inflammation. I know earlier we said that this myel is our root for spinal cord. But that doesn't really translate directly in this one. But you should just know osteomyelitis is a bone infection. I think that's on your additional terms. Gout is a disease that affects joints. A lot of times it actually affects the big toe, is a very common area for gout to flare up. But it's a buildup of uric acid. Uric acid is just a byproduct of our metabolism as we're processing certain foods. Gout flare-ups tend to be associated with fatty foods, but gout is like a buildup of this type of crystal that is created from uric acid that gets into the joint, and it can be very, very painful. Okay, myasthenia gravis. This is from your new list. So asthenia is a suffix for weakness. My or myo is your root in combining form for muscle. So put them both together, muscle weakness. And then last but not least, fibromyalgia. So this is another diagnosis that is relatively common. So algia is our suffix for pain, and then fiber without our E is our word root for fiber, fibro combining form. So this stands for muscle or fiber pain. And so this tends to be very generalized total body pain, very sensitive to touch and pressure, and this can go through flare-ups as well. So fibromyalgia, muscle/fiber pain. And that is our last one for the muscular system. So I know it's a lot of words between both lists. That's why I'm saying get ahead of it, really start using Flippity, use Quizlet. There's a learn function on Quizlet. So if you go into Quizlet and add in your word list and then hit learn, it will give you the option to put multiple choice and true, false, and fill in the blank. However you would like to learn the material. You can even use the test function and make yourself your own test. So I highly recommend using Quizlet if you're struggling to get all of those word parts memorized. All right, thank you, and I will be back shortly for your lecture on the muscular system.